Welcome to another edition of Monitor Your Health, where we make time to educate Nigerians and our viewers in diaspora on health issues of concern. My name remains Dr. Femi Ogunremi, and I will be the host for today. Now, as human, there are a lot of things that is quite interesting about us. We are an advanced, creature, and there's a particular reason why that is, or there are reasons why that is. And one of the reasons is our brain is quite advanced. It's not that it's big, it's just quite advanced because we have some sort of creatures that have bigger brains than we do relative to their body. Or as human, we're lucky to be able to use our brain more effectively than them. Fortunately or unfortunately, there are a lot of things that could happen within the brain that might be very important for us to know. And today we have a specialist, an expert in-house who will be talking us through or be answering all our questions around a particular topic called dementia. We want to know whether dementia is the memory loss or whether there's any other thing that we need to know about it. I would like to welcome here with me, Dr. Olumide Adeotoye, who is a consultant geriatrician from the UK. You're welcome on board, sir.
Thank you, Femi.
So please, can you tell us a bit about you, and then we go into the business.
As you said, I'm a hospital specialist, a geriatrician. A geriatrician is a physician who takes care of older people. And as you may or may not know, dementias are common in older people. So day in, day out, I care for patients that have dementia. I originally trained in Nigeria, the College of Medicine, University of Ibadan. But wow. I did all my postgraduate training in the UK, in and about the Midlands, for those of you that live in the UK, the West and the East Midlands. But I actually work just outside London, just outside Northeast London. That's where I work.
Thank you so much. So you're going to help us today to trash this topic. And if we can just start, what is dementia?
Yeah, that's a good question. I bet when you say dementia, most of the people, they just think of memory loss. So if you ask your average person in the UK what dementia is, they'll say old people with a poor memory.
Right.
Whilst memory loss is an issue in dementia, it's not the only issue. And sometimes it can be the least of problems, because memory you can actually compensate for. There are things you can do to help you cue your memory. But just to give you an idea, one of the commonest presentations of dementia, say in the UK, is a person saying, my mom or my dad have forgotten how to get back home. So they leave home, they go to a supermarket or to a shop, and they get lost. They can't find their way back home, and then they have to be rescued. And then it happens once, it happens twice, and then it keeps happening. And then things progress. So whilst memory loss is part of the issue, it's not the only issue. Dementia is a progressive condition that affects the brain. It's one of those things that we call a neurodegenerative disorder. So in the brain, you have a particular type of degeneration, and it manifests as difficulty with the memory, particularly the short-term memory initially, right. Difficulty with learning new things, sometimes difficulty with your language, the ability to communicate, difficulty with just the usual things you do, like getting up, having your bath, wearing your clothes, difficulty with sequencing dressing. So normally you'd bath, you'd wear your underwear, then you'd wear your shirt, then you'd wear your overcoat, and that sounds easy. But
Right.
with dementia, that could become a chore. So it's those sorts of things. So it's not usually just one thing. It's not usually just a memory problem. It's very unlikely if all there is a memory problem that that's due to dementia. But
Right.
it's a pattern of things
Wow. Thank you
that
so much.
constitute dementia.
That must be quite frustrating, to be honest, because if you can't, you can't actually, remember things. Like I can imagine I'm sitting down here and I don't know where am I again. That's really frightening. So apart from the fact that the memory, is there any other thing that could, concurrently happen? I know it's a neurodegenerative disorder, like you said. What are the other telltale things? Maybe things that people might be, be noticing subtly, and then maybe they've left it.
Often at times, another thing that people commonly notice is that they notice that there's a change in personality. And they say that this person doesn't sound like or doesn't feel like my father or my mom anymore. One thing that I've noticed commonly is that some of their personality traits are reinforced and some of their other personality traits are suppressed. And what is quite memorable is that a lot of the negative personality traits are reinforced. So someone, excuse me, who is naturally stubborn becomes extremely stubborn, difficult to deal with. Somebody that is prone to anger becomes extremely angry, and little things, they're argumentative and things like that. People that are very passive, they may become extremely passive. So they don't interact, they don't engage. So people generally tend to notice a gradual, subtle change. Initially, they think, oh, they're getting older, so they don't really take any notice. But over time, they look back and they say, oh, this has been happening. That's another thing. It doesn't happen at once. It's very difficult. It's very subtle. And it's only over time when you look back can you say, oh, yeah, this has been a problem for some time, but it's been gradually getting worse. I've noticed that their memory has been gradually getting worse. I noticed that they forget where they put things. I noticed that they forget things that they've just done. So it becomes a picture. I've noticed that they're having difficulty with managing their finances. So it's a whole picture that gets worse over time. And the expression can be unique to that individual. So it's not always easy to say, because Mr. A has a dementia, Mr. B will behave in exactly the same way. Because don't forget, there's the personality there that may determine how things progress.
Wow. Thank you so much. So now we know that memory loss, personality changes, are things that can easily or be affected that we can pick. What could be responsible for somebody who is being completely normal and suddenly start getting into this pathway? What could be the reason?
Yeah, that's a very good question. That is, it's been investigated, a lot of research around it. But as you said earlier, the brain is a very, very complex organ. We have some theories, but we don't know exactly why. Our theories around in the brain, you have some things called chemical messengers. As we all know, each organ tissue in the body is composed of little units called cells. And these cells, especially in the brain, they communicate with chemical messengers. And they're chemical messengers that have to do with different functions. So for example, memory, we think that there's a chemical messenger called acetylcholine, which is a chemical. And it's this chemical messenger that passes messages from one brain cell to the other that has to do with memory. So our current theory is that there's a problem with that chemical messenger. Now, the cells that produce that chemical messenger, for some reason that is not known, they start dying off in great numbers in those areas of the brain that have to do with memory. And so as the cells die off, that chemical messenger becomes deficient.
Right. So could it be associated with anything else? As in, what could trigger that change in the chemical message?
That is the source of all the research. That why, as we all grow older, we start losing brain cells. So that is across board. But for some unknown reason, in these neurodegenerative disorders, these people, they lose more brain cells than your average person, and in particular areas. So the model that I just explained relates to the commonest dementia, that is Alzheimer's disease. But there are other types of dementias. But that particular model that I just described relates to Alzheimer's disease.
Okay. So as Alzheimer's disease, what is that?
Alzheimer's disease is a type of dementia, as I described earlier, where you have the loss of these particular cells that have to do with this particular chemical messenger called acetylcholine, and that can manifest as short-term memory loss, personality changes, difficulty with simple tasks like dressing yourself, making a cup of tea in the UK here, perhaps in Nigeria, making pounded yam, I don't know, and ogbono stew. So things that you ordinarily could do with your eyes closed become a chore. Managing your own finances, the relationships you have, relationship with your children or with your family members becomes fraught, because either you're very stubborn, you're very difficult to reason with, or you're prone to anger, or you become extremely passive. Then the sort of things that you would do on your own, you start needing help with. So, and it progresses over time. So these problems, a particular issue with learning new things.
Right. All right. Okay. So old memory, the long-term memory would be preserved.
Initially, it's preserved, but as the condition progresses, initially they may have problems with, oh, Dad, Mom, what did you have for breakfast? And oh, I can't remember. So that is short-term memory, but they can tell you all about when they were a child and the school they went to, and when, if they went to uni, what happened in uni. But as the condition progresses, even the long-term memories begin to fade. But initially, whilst they still have good long-term memory, they tend to like to talk about the long-term because they can remember those things, and they don't want to talk about the short-term because they don't remember those things.
Right.
So they reminisce. They reminisce a lot.
So you talked about other types of, dementia. Apart from, the Alzheimer's disease. What are the other types?
There are three main types. You've got Alzheimer's disease. You've got the vascular dementias. The vascular dementias are associated with problems with the blood circulation to the brain, either due to a series of strokes or one significant stroke. Or sometimes, for example, in people that have diabetes or hypertension, they may have progressive changes in the brain circulation that are associated with some of these things I've said. So those are vascular dementia. The third type is a mixed dementia, where you have Alzheimer's pathology and vascular pathology, and they have a mixture of features that go with both of them. And there's some other less common, like dementia with Lewy bodies and so on and so forth. But I think the three main ones are Alzheimer's disease, a vascular dementia, and a mixed dementia.
Okay. So for this vascular dementia, it's quite interesting actually. So you said series of stroke. I think what might be pondering in people's mind now. So people can have series of stroke and they do not know it, and then boom, they're developing, dementia. How does that happen?
Well, talking about strokes, and just for people that wonder what's a stroke is a situation where you have a blockage to a major blood vessel in the brain. And when that happens, that area of the brain dies off. Now, you can have a series of very small strokes that don't come to the consciousness. So you're not aware of it. Most people, when you say stroke, will think of half of the body and loss of use. And indeed, that is true. But there are certain conditions like poorly controlled high blood pressure, like diabetes mellitus, that are associated with series of small strokes, which on their own may not come to the fore, but with time and progression, they damage areas of the brain, and that may manifest as a dementia. But also it is possible to have one strategic stroke in a strategic area of the brain that
Right.
will be associated with a picture suggestive of dementia.
Wow, thank you so much. So it's been quite an educative, period for me personally, and I'm sure our viewers in the house will be, enjoying this. I want us to have a look at what people actually are saying about dementia. We went out to just find out what are people's view about dementia. So I'm going to share my screen, and then I will play one or two of this. Let's see if I can. Yeah, I can find that now. So I'm going to just to see what people say about dementia. Hopefully, I'll find this now. Yeah. So let's go that way. Right. And let's play this and see. So. I hope he plays. He doesn't seem to want to cooperate now. Okay. Okay. Oh, unfortunately, I don't think this is playing well now. Okay, that's fine. That's all right. So we went out, and then what people are saying is a lot of people do not know what dementia is. Some people will say that dementia it's hereditary, and then I just want us to to throw more light into that aspect. We know that there are certain things like maybe stroke that can cause this. Some reasons we don't know why dementia will happen, but are there any other things that might be associated with it other than maybe vascular, which is we learned might be stroke, and the other bits which is Alzheimer, which we do not know what might be causing it. So just to enlighten people at home who are saying they're not really sure what this is on about. Any other thing, sir?
Just to talk about heredity,
yeah.
The dementias are not inherited like that.
Right.
So we can take that off. They're not inherited. The common forms of dementia are not inherited. There's some very rare forms of dementia that occur in relatively young people, like in their 40s or 50s, that can have a truly genetic basis. But the common forms of dementia that happen in older people are not inherited.
Okay.
But having said that, there are some factors that are genetic, to do with what we call some of the fat components in the body. There's a fat component called apolipoprotein E.
Right.
But the interesting thing is that when they did studies comparing African populations, actually African populations that live in Africa and African Americans, so i.e. Americans that are sort of related to Africans, but that left Africa several generations ago, they found that whilst this apolipoprotein E was relevant to African Americans, it had no relevance to indigenous Africans.
Wow.
So even so, it's not clear that there's a genetic a strong genetic element to dementia in Africans.
Right.
But because these conditions are not rare, it may appear to run in families. So you might have two brothers that have dementia, and they may think that because both of them have dementia, that it's inherited. But we know that there are probably some unknown environmental triggers for dementias.
Right.
What these triggers are is not very clear. There are risks. So for example, there are some risk factors for dementias, things like smoking, alcohol, obesity, diabetes,
Yeah.
hypertension, age itself, old age. And
Right.
in Africans, interestingly enough, the female gender, the female sex.
Female
The
gender.
risk,
Right.
yeah,
Wow.
women, and I'm talking about the older women,
Yes, yes.
are twice as likely as men to develop dementia from the
Wow.
epidemiological studies done in Africa.
Is there anything linking to that?
It's
Any?
not clear. It's not clear. Usually when things are common in women, they always go on and on about hormonal things because they look at what are the differences between a woman and a man. But I'm sure there are differences in the brain too between a woman and a man. Whether,
Right.
and I'm not sure we've cracked all of that. Whether we ever will is a different story altogether. Because think of the most complicated computer you can think of, the brain
Mm.
that.
Wow. Thank you so much for that. So now we know that, this can happen, and it can happen at, any age, like you put it earlier on, but majorly it's usually in older age group that we have this happen. When we look at Nigeria, because I know a lot of our followers today will be Nigerian, and they'll be asking, is this thing really happening in Nigeria? Is this something that they need to be, to be worried about, or are we just talking about some highfalutin things that happen in the white man's land? What do you say to that?
To put it into perspective, I looked up some studies done in Nigeria and in sub-Saharan Africa. It's estimated that in 2015, there were 2.13 million, so just over 2 million people in sub-Saharan Africa with dementia.
Wow.
It's estimated that by 2030, that will be 3.5 million. By 2050, that will be over 7.5 million. So Femi, do you think it's a big problem? In Nigeria, so coming to Nigeria, in Nigeria, the prevalence of dementias is about 5% overall. It's about 3% in men and about 6% in women. So 5%. So let's look at it, 5% in those over 65.
Yeah.
So even allowing that Nigeria has a relatively young population, but even if we say 10% of Nigeria is over 65, and we assume a population of 180 million because we're very conservative like that. So that is 18 million. And if we say, what is 5% of 18 million? You're looking at, I think, 900,000. So even if we go even more conservative, 500,000 people in Nigeria have a dementia. Is that a big problem?
That's
Try
a big
to crystallize it.
Yeah. So that then take me to the next question I'm going to ask. The burden of this disease itself on individual, on family, on on the society. That's a big burden actually.
It is a big burden.
You have
it's
that number.
A massive burden. If I remember well, the figures for the UK, I can't remember. It's like 8 billion spent a year. I'd have to confirm that, but several billion spent a year on dementia care. Out of that, over half of it is on social care. So not the tablets, not the hospital, but social care, supporting them. I remember several years ago, I had an uncle, a very eminent professor, is late now, and I won't mention his name, very eminent, and he had dementia. Although I wasn't told so, but when I visited and I looked I knew I had dementia. It is there.
that,
It's in our community. It's hidden because you know how it is in our community. Now, if you have something like that, they'll put you in the house. If they have the means, they'll employ people to provide 24-hour care, and you'll not see the light of day again. So it's quite. So it is. Yeah, it is. It is there.
Quite. It's quite tough for the person that is going through that. So how do we diagnose this, and then we go into the if possible treatment.
The diagnosis is not as easy as it sounds because there's no specific test. There's no blood test. There's no brain scan, at least not in routine clinical use. There's some experimental brain scans, but there's no brain scan in routine clinical use that you can use to diagnose a dementia. What you're looking for is a picture. So you're looking for a picture of memory difficulty, perhaps difficulty with short-term memory, difficulty with managing their daily chores, difficulty with managing the daily activities, managing their finances. So often at times you would need what we call a collateral history from a family member to tell you about, and then you can test all of these things by doing a test of cognition. So these things are what we call cognition. So, and there are several tests that you can do of cognition, things like mini mental state exam, MOCA, Montreal Cognitive Assessment, ACE, CAMCOG. So there are several tests that you can do that go through an inventory that has to do with memory, has to do with recall, has to do with language and things like that. Orientation, attention, because these are the various areas that are impaired. And so you put that together with the collateral history, you look for progression over time, and now you can support these by doing a scan, a brain scan. When you do a brain scan, what you're trying to do is exclude certain things that could mimic, and then look for certain changes that may support, but you can't use a brain scan to actually diagnose.
Right. Thank you so much. So now let's say we now know what's, I mean, we have the kind of inclination that this person has got dementia. And then we've done all these investigations and it's pointing in that direction. What can we do? Now I'm moving a little bit towards what can either the clinician or the family members or people around that can support this care. What are the things that we can do to support whoever is in this research?
Let me just quickly talk about medications, because our people, we like medications. So we do not have effective treatment for the dementias in terms of medications. We do have some medications that have to do with that chemical messenger that I talked about earlier, but don't forget I said brain cells die. And so we have no way of replacing dead brain cells. So these various medications that we use to replace the chemical messenger have very modest effect. And usually the effect wears off within about 6 months anyway. So we don't have effective medications for them. But now talking about what else can we do? So what we tend to do is assess what are the needs, the care needs, the deficits. How can we deal with those? So if the problem is someone that is forgetting things, do we need to have a diary that they can use to cue them that when you wake up on Monday at 8 a.m., this is what you need to do. At 10 a.m., this, and people use those things. They use cues. People use them themselves so that when they can remember, they write it down. Now, this is what I need to do on a daily basis. So things like that. In some people, it might be physical help that they need. Or, for example, watches that remind. So you've set the watch at 8 a.m. to remind you, take your tablets or go to the shops. So it's aids, technology to help, to remind, or physical help to help with the chores they can't do. One of the important things that I want to raise is that those of you that might have parents or aunties or uncles, once it's diagnosed, first you need to, if you have concerns about memory, then go and see someone. Here, it might be an old age psychiatrist or a neurologist. In Nigeria, it might be a neurologist or perhaps a psychiatrist. But go and see someone so they can do the tests, because you can have age-related memory loss. That is not dementia. So get the test done. And why? Because once you have the diagnosis, you can start putting things in place. Don't forget, this is a progressive condition. It will progress. And so you want to start dealing with things whilst you can. So once the diagnosis is made, then you can start having discussions with your dad, your uncle, about their finances, about their estate, about how they want to manage things, about how they might want to manage their health as things progress. And these are the discussions you can only have on this side of their deterioration, because they may deteriorate to an extent that you can't have these discussions anymore. And that's what we encourage them to do here, to start having discussions around what if things progress? What sort of steps do you want us to take?
Right. Brilliant. So it's more like you need to, start doing palliative,
Yeah, you need to start putting things in place and to start having these honest discussions and not to bury your head in the sand. Even if you think that, as we do, because we're spiritual beings, we're very spiritual in Nigeria, there may be an apostle or a pastor that can lay hands, and they may well be. But at least until then, start putting things in place, start having these discussions. And if indeed you receive a divine miracle and no reason why you can't, then you've lost nothing.
Yeah.
But if you don't put things in place and you don't get that divine miracle, you may lose a lot.
Yeah, thank you so much. I had a discussion with someone, I think yesterday. We're talking about an elderly lady who actually, unfortunately, she started mixing her medications up, and they were like, oh, is it dementia? Is it memory loss? Well, in England, I know that we have, dosets of tablets and things like that. But unfortunately, there's no such things. And then this lady was, she's been taking double dose and things like that. And I thought, wow, what do we do for people like this in this environment, So when you're talking about using, wristwatch and things like that, I think those are the little things that can be done just to support institutions like this. Thank you so much. So I know that, a lot of things in our environment here, even though you're practicing in England, you trained here and things, a lot of things are being stigmatized, that's when you have somebody, they said they have memory loss, it will be the reason why they probably lock them up in their home. Is there any advice you want to give people on this? Because personally, I believe that when there are issues, it has to be brought to the table, discussed and understand it, and let everybody know clearly about it. What's your advice?
I think some of what is required is what we're doing here, to raise the awareness. So if people know that these things exist, these people don't need to be discarded. It's progressive. So you have people that have mild dementias, moderate dementias, severe dementias. And whilst they have mild and moderate, they can still enjoy life. It just requires adjustments. Adjustments, seeing where the impairment or deficits are and trying to address them. There are people that are high performing with dementia because there's what you call a ceiling effect. So for example, if you have someone that is a professor and is an academic, so they're right up there. If they have dementia, they may come down here. So there's still things they can do. They may not be able to lecture, but they can still do the routine things. So I think we need to help them to maintain the routine things they need to do as much as they can, because that is where they derive pleasure. And perhaps we may be able to delay things if we help them to use what they have. As they say, if you don't use it, you lose it. So if you just discard them, then quickly they will lose what they have. So we have to try to help them to maintain what they have.
Right. So that brings me to, in terms of the support in maintaining them, where is the role of things like maybe physical activities, or is there any?
I think there is a role for physical activities. I think there's some school of thought that says that if you continue to challenge the brain, that perhaps you can slow down deterioration. Now, I can't quote any strong evidence for this, but the least they'll enjoy the exercise. So if you can find things that they can do that will stimulate the brain, so what can they still do? And concentrate on the things they can do. If there are people that like reading things, read. If they can't read, or audiobooks, things like that. So there's still things they can do. If there are people that like watching current affairs, then allow them to watch it on TV. At least they'll be able to follow some of the things, and that keeps them alert. But I think the wrong thing would be to just put them in a room and get house help to just tend to their needs and take everything away and say, oh, dad, mom's going gaga. Just no, find out what can they do and allow them to do it and support them in what they can still do. And hopefully, as we progress in our nation, we'll start getting help groups. Because as you know, in the UK, they may go to a day center with other people, mixed abilities, and they actually enjoy these things. They look forward to it. It keeps them going. But to just guard them would be a tragedy for them.
So somebody is asking a question that in an environment that is hostile, if, for instance, what I can pick from this is, if in this environment, when people start going gaga, they just say, okay, maybe we'll tie them, we do so. Does that make things worse for them, or?
Well, let's put it this way. That is not even the question. The question is that humane? Is that kind? Would you want to see your dad tied up? It's not, even if, let's even take worst case scenario, they had mental health disease, they had schizophrenia, bipolar. Would you want to be tying them up? Is that the best we can do? The answer is no, it's not the best we can do. There are strategies for dealing. Even there's something we call the behavioral and psychological manifestations of dementia, where they become agitated, angry. There are strategies for dealing with these things. And none of them include tying them up or handcuffing them. So I think we need to move away from that. That is really Victorian mental health care.
Thank you so much. And there's a question, somebody says that he noticed that he loses memory when he's quite stressed out. Does it mean that he's having dementia?
No.
Right.
Those of us that are beginning to get on, I'm sort of in my late 50s, those of us that are beginning to get on, we find out that we begin to have, what I would call retrieval issues. So I'm talking to you and then I want to tell you about Bumi Shodairo, that's just a makeup mate, and what happened to her. And then I'm talking to you, then Bumi disappears from my mind. I say, oh, you remember now? You remember that young lady that we saw at that party? And I explained and then towards I say, oh yeah, Bumi Shodairo. So that's a retrieval issue. And you find out that as you get older, you start having those sorts of, and you start to panic that, am I different? And then, but when you remember that, oh yeah, that's it. Or I'm talking about Arsenal, my favorite football team. Yeah, we're Gunners. So I'm trying to remember a player. I can't remember that guy that plays 10. That guy's that plays 10. That is from Turkey and all of that. And then I can't remember at the time. And then later on, I remember, oh yeah, that guy. And I say, oh, nothing do me. It's just So yes, you can have, and yeah, if you're stressed out, yes, you can have lapses. So that is not dementia. So be assured.
Thank you so much. So, yeah, human support. Okay, that one, I think that one has been answered in between the talk. Okay, so now we now know that we can actually, there are things that we can do to support, these people. Is there a particular food that we need to, that's one of the questions about, I didn't want to answer that before. I think we should just answer it. Somebody's saying, is there any particular food that we can take to prevent dementia?
Yeah, I'd like to tell you there is. That over the years, there's been a lot done. Initially, they were talking about vitamin E, and there was a lot of research on vitamin E, but the bottom line was that no, it doesn't prevent or even reduce the risk of or reduce the severity. And then they talked about, I think it was coenzyme Q10. And then there was a lot of stuff, and they were using coenzyme Q10 for everything. And it was so expensive, but people kept chopping it anyhow, and they were chopping the thing. But when they did all the research again, no, it didn't help. At one time, they were talking about aspirin for vascular dementias. That, okay, if the problem is circulation, surely aspirin is a good thing. But no, aspirin doesn't help. It may help with preventing heart disease and maybe preventing stroke, but it doesn't help with preventing dementia. But there is evidence to suggest that a balanced diet is good for brain health. So a balanced diet. So not just eating pounded yam and ogbono every day, or as our Kitty and Ijesha folk would do, having pounded yam every. Femi, are you a Kitty?
I'm a Kitty, but my Kitty is a diluted Kitty para.
Having pounded yam every lunch and dinner time, that is not a balanced diet. Having your fruits, having your vegetables, having your nuts, as well as. And yeah, maybe there's a case for having, as you get older, taking multivitamins. But yeah, and exercise. Exercise is good for brain health.
Right, brilliant. Somebody is asking, what can I do to improve my memory?
Some people talk about there are certain brain tests. They're like puzzles. They're number and word puzzles. And if you go on the internet, there are plenty. Then boku for internet. I hope people don't mind me speaking pidgin. But those of you that don't, there are plenty. Those of us, then boku for internet. So, so yeah, but I don't know that there are any specific things. I think there's something around use your brain. They say that throughout a whole lifetime, we probably use maximum 10% of our brain potential. So use a bit more of that potential.
So it's more like an exercise. You exercise your brain.
Exercise your brain. If you exercise your muscles, you get muscles.
Exactly.
So exercise your nut, and yeah.
Thank you so much. So we will be rounding up at this juncture. I just want to really thank you, Dr. Adeotoye, for giving us your time, because I know if I can say this, as an associate medical director in your organization as well with your work, your clinical work, you're quite busy. I had to drag you into this, and we really appreciate the time. And to you, our viewers, I hope you've learned something. I hope you've gained something. We as a high, high profile, I would say, being, we need our brain to function well. And what we've tried to do today is to talk around, our brain health and how it relates to our memory and relates to dementia. We've had a lot of, insightful conversation here, and I hope that you pick one or two things that you take on to also support either others or also support yourself. So it's really, really nice to have you here today. Please don't forget.
Thank you very much, Femi.
Yeah, thank you so much. So for our viewers, please share these messages the goal of Monitor Your Health is to bring, to Nigerians and, our viewers around the world, important topics that we believe are topical and we believe that you will learn from. So if there are topics you want us to deal with, you can always leave message down. We will pick it. And for those of you that have asked questions and we haven't answered it, we will get on this online. We will answer your questions. So if there are other ones that you feel even later, you can leave it in the comment section. We will keep answering as we go. Thank you so much, and I look forward to seeing you again. We have the next one on Saturday. All right, thank you, sir. So
thank you. God bless.
Thank you.
Bye.
Bye-bye.
Bye.
Bye.